people spend the majority of their time at work. So it's really important for them to learn what are those exposures, what are those hazards at their work that they need to really be aware of.
It's about mitigating that exposure so we can come home at the end of the day and be healthy.
Almost 5,000 workers die each year in the United States just from traumatic injuries. More than 50,000 workers each year die from work-related illnesses as well.
Las lesiones y muertes en el trabajo afectan a todo el mundo, no solamente al trabajador, ¿verdad?, que murió, que se lesionó, pero afectan a los demás compañeros de trabajo y afectan a la familia y en general a la comunidad.
UCLA LOSH was created to deal with the many tragic and preventable deaths in Southern California and in the country. Our programs empower workers through outreach and education, research, and then involving workers in policy change. Our training programs develop leadership skills. We have certification for worker health and safety specialist.
LOSH fills a big hole for worker protection because there's a lot of other organizations, companies working out there that don't have anything to protect them. And so there's this umbrella that's out there to help get people trained.
LOSH trains about 2,000 workers and worker advocates each year.
I think trainings like these are important if you're going to know how to deal with the environment, or how to deal with the hazards, what to look for, and what to expect.
Our research here at LOSH is based in the community. So we partner with organizations that advocate for safe jobs for a range of workers with a focus on underserved worker populations.
We've been fortunate enough to have 4 rounds of LOSH interns that have worked with us. Without the support of LOSH and the research that they helped to analyze, we wouldn't have been able to know the needs that workers have, the experiences that they have in the workplace, and without that information, we wouldn't be able to move our programs forward.
The struggle for safe jobs and good working conditions goes hand in hand with the struggle for social justice for workers overall.
El comité de promotoras somos personas líderes entrenadas en el tema de salud y seguridad laboral por el programa de LOSH. Las comunidades en que nos enfocamos son la población de trabajadores inmigrantes de bajos recursos, ¿verdad?, que están más vulnerables a lo que es este tipo de lesiones y enfermedades en el trabajo.
Immigration status and racial justice is important because companies specifically target these communities, right? Because they think, oh, they don't know their rights, they're afraid, they're not going to speak up because of their immigration status.
We partner with many organizations in the community for workers to have a voice on their job through labor unions, through community organizations and worker centers that also address wage theft. They also address discrimination and the disproportionate impact of workers being placed in dangerous jobs.
The partnership with LOSH is so important for our folks because it allows them to provide for their families. Often a barrier for our folks to get to work is having these certifications, having specific training that is a prerequisite for most entry-level positions, specifically in construction. These certifications allows them to stand out and allows them to be hireable and more marketable in the workplace.
We've been fortunate to be able to create these scenarios in many communities where we have seen workers now being able to buy homes within a short period of time, have families.
You get the great training, the great certifications, and you also get an introduction to non-traditional industries that we don't normally have access to or information on how to get into.
They move on with this knowledge that they can be respected at work in a safe environment, and they carry on these expectations to other employers.
Together with our partners and with our network of strong leaders in the region, we can collectively make sure that working conditions are improved and that workers can go home each day without disabling or debilitating injuries and illnesses, so they can fully participate in the lives of their family members and their communities.